when people do their personal stories, I look around the room and I'm watching everyone, and you can see people that have got the condition that are nodding and agreeing with it, or they have a family member that have got the condition and they can nod and agree with class. And then you see the parents that find some bits of it really, really tricky to hear, but then you go, actually, there's the positives in there. For me, going about your job, you're going to college, you've got a family. And there's the different things that everybody picks out of it. Because I know whenever people do presentations and things here, they worry, is it going to be enough? Am I going to? And I know Tor was worried. They're not going to find it interesting. I said they will. I said they'll take something. And I can assure you, when I was looking around, people were taking things from it. What I'm going to do now is I'm going to pass you over to Lisa, who is our occupational therapist, and then that will lead through into Carol. Okay. Wait a sec, it's going to load up.
Well, I'm going to do introductions first. Perhaps some of you might have met me before. My name's Lisa Hayward. So I'm one of the trustees on the Maffucci Knowledge Association and the Red Robin Trust, and I'm also an occupational therapist. Although my experience isn't to do with orthopaedics, my background is mental health. So I've worked a lot in child and adolescent mental health, and I'm currently working in an autism team. So I suppose it kind of links in, I'm told to not here, but into kind of what some of the key things she was talking about, the effect on emotional well-being, which is paramount, I think, because it does, regardless of what age you are, even children are kind of experiencing some of those challenges that were so articulately talked about earlier. It needs to be looked at in addition to kind of the physical elements of it. So I suppose I'm doing a very short little snapshot of what occupational therapy is, really, just to highlight that there is support out there thinking practically, not just thinking about how to fix looking at the kind of elements that the doctor was talking about earlier, but thinking how do you actually function in day-to-day living. That's what occupational therapy is about, and I'd hope that there's people in the room that have had experience with occupational therapists. Anybody? Yes, I know some people have, or some people maybe have never heard of occupational therapy. So I can't really see what's on there. What do I do? Okay. So what is occupational therapy? So it's looking at functioning, so in daily living, so we call it activities of daily living. So from getting up, washed and dressed, to being able to go out to school, to go to work, to do things you enjoy, socialise. They're really key things that help us with our emotional well-being as well. So as occupational therapists, we look at how do you actually do those things, and that can be from a very practical basis. It can also be looking at adaptations and equipment to enable you to be able to do what you want to do with your day-to-day living, and sort of supporting general independence as well. We look at across the lifespan, so you'll have OTs in lots of different teams, so in children's paediatric teams, in adult services, in orthopaedics, in mental health teams, in adults and children's teams as well, and we work in lots of different places, so it might not just be in the hospital setting, it's going out to your homes. What things do you need to be able to assist you to be able to get up and get yourself ready for work or for school each day. And I think I've just written some information there about the kind of areas that an OT might help with. Would be thinking about the physical problems, so there might be growths on your hands that's stopping you from doing things, like a child within the classroom being able to write and keep up with their peers, and then that potentially can impact on their self-esteem if they're not being able to keep going. So it's important to kind of address those sort of very practical things and trying to do it as early as possible. And asking the question, so whoever you're seeing, the surgeons or doctors, saying, how do I actually get on with being able to get out and go to school or go to work? Can I have a referral to an occupational therapist? Just asking those questions, because although might not be somebody, an OT, that's experienced with Maffucci and Olliers, it's knowing that they can help you in a practical way, because they may be able to, they may have had contact I know we've got an OT here at the moment back there that has experience with the condition. So, you know, we've got it's hand therapy, isn't it? So there are people out there that have had contact, and there's lots of doctors. I know Professor Flanagan's very keen on OT. She's talked about it in her talk, in that, you know, she's aware, and they will contact the services. And I've said about so with children, practical support can be with adapted seating and equipment that might be needed, and occupational therapists can provide that. And with wheelchairs as well, there's specific teams that would be looking at that. And I think I spoke more last time about mental health, because I think that's something that's sometimes missed, and Tor was talking quite well about that. And not to miss that. So not necessarily from an occupational therapist, there's psychiatric nurses, different professions within mental health teams, but there are access and support out there. And I think there's been a report done this year that's looking at the impact on mental health of having a rare condition. So I think they are looking at the kind of importance of addressing that, and making sure that they're teams can refer to, and make sure that is looked at, as well as the physical elements of a rare condition. So it is very important. And I know the next speaker, Carol's going to be talking about how different strategies and different support that is available out there, and to make sure that you do find out what services are within your local area. So I don't know. I mean, have people had a chance to kind of access services out there? Have they had barriers there that have stopped them being able to kind of find services?
I found with James, just asking the surgeon to refer him to this psychologist was that simple. I said that he struggled with his emotional state, and he doesn't like his disease, he hates it. And since he's been seeing her much better and deals with it better, and he sees her throughout, before operations, he sees her every 3 weeks basically,
Right.
and then throughout the whole operations and things.
So you're getting that support ahead of an potential operation, but also just ongoing support, which is really
Just
important.
asking, because I was struggling for ages.
Okay. So feeling confident to ask is the start.
My son, we've had different x-rays and things like that, but no one's really mentioned kind of keep an eye out for kind of the mental health aspect of it. I didn't know about the likes of the hand therapy. The chondromas are in his fingers and they haven't caused a problem, but they're starting to grow more noticeably now, and I think the likes of hand therapy would be something that would be useful, but I didn't know that it was out there. So it's from a lack of knowledge, from my point of view, coming to it, it's great to hear about these sort of
Yes,
things, but
yeah.
it'd be handy to know, well, how do I find out more about hand therapy, or ask for a referral there, but
Yeah, it's being confident to ask that question though, because you're putting your trust, aren't you, in professionals you're going to, and if they're not suggesting it, you think, oh, maybe that's not an option. But I suppose this is about knowing that you can say, can I get some help with those things? Can you refer to X, Y, and Z and look into it?
or even if there are any resources out there for parents, because my son's 11, I'm going to be his first point of contact, so when he's talking to me about people have been asking him about his fingers or about the shape of this or the other,
Yes,
how he's asking how does he explain it to people, or how does he deal with that kind of, there's something different?
I don't know, because Rare Disease UK have got that. That's where I saw the link about the mental health awareness, and that's new this year. So having a look on there to see if there's any other resources for helping talk about things now, that might be an option. I don't know whether you know anything. That's where Charlotte is. Whether you know anything else, Matt.
Contact a family have
Oh,
some
contact.
good bits as well.
Yes.
They have quite simple information, and also links to different things, so that's probably where some support. They tend to be for rarer conditions. So it's
Yeah.
really
They were supposed to be here today, actually.
They were, weren't they?
We've had a representative from Contact a Family. They were supposed to be coming today, but they are a very useful resource.
Yeah.
We can pass the links on for that as well, for those that want.
Have you actually, because contact a family, you can actually speak, then that puts you in touch with other families, doesn't it? And you can
Yes.
speak to them and
Yeah.
get that support. And obviously here, we've got lots of people here, and
I
hopefully
know
you
when I
can...
typed in kind of Ollie, because Ellie, they first thought it was something different. I thought it was polycystic plague or something when we got the x-rays back, but just typing in and finding something and then a link to you guys, I think it was just like, hurrah!
Yeah, so there's some answers
You
on
can
there.
find some bits, and it was quite basic and easy to read information, so actually even just having it printed out that you give, I don't know, to a
Yeah.
teacher or maybe I know for the school. I've got friends with kids with rare things that they'll go and do a talk at the school, quite a generic talk about difference and different things.
Yeah.
And I think it depends on your child and their age, but and what they'd be happy with.
But I mean, for kind of getting contacts and how to get a referral, I mean, obviously you might be seeing a surgeon, you can ask them to contact and refer you on, but you can also go to a GP. So if you're seeing signs of your child or you feeling more anxious, or your partner is kind of struggling going out and you're kind of concerned for their emotional well-being, you know, going to the GP and asking there as a first port of call as well, and that's, you know, explaining that it might be in relation to your future early years, but you know, it's affecting your mental well-being, so actually it doesn't matter, you know, they might not necessarily have the experience of that particular condition, but they can help support and understand the kind of how it's affecting you in daily living, and then kind of getting forward, so going to GP is a big thing. So yeah.
We found that our daughter's 5 years old, and we saw a psychologist, but I don't know how much value we actually got from that, given she's such a young age, but play therapy
Oh yes.
was really, really good, leading up to surgery and afterwards as well, and during the time in hospital,
Yes.
play therapy was amazing.
That is
Really good.
yeah. That I've had experience with play therapies
Yeah.
actually, and have it so ahead of even going to like having any sort of going to dentists, those sorts of situations, but like obviously with a big surgery, then having that time to normalise it and make it safe to be going into there is really important. Yeah. But I suppose more was because I know there's going to be a lot more discussion next about from Carol, but it was just a very sort of brief summary of what occupational therapy is, and knowing to think about how it affects you practically and asking for that help. And I know there's a number of people here that have had experience with therapists to help them every day. So
Can they come and have a chat with you at the end? Have they
Yes,
some links
of
or
course,
some
yeah.
contacts? Or
Contact the
Yeah.
family link is on the website.
it's on the website.
It's on our
I
website.
don't
Yeah.
think I've put anything else. Did I put on? Is that I did things consider? I'm thinking about goals. Yeah. Yeah. So if you're having surgery, asking to meet a therapist before this, I think that's something that Meryl had said actually, wasn't it? So make it planning what you're wanting to still do after it, and make a plan of what intervention you're going to have following surgery from a therapist's point of view. And I think about referrals, and so there are private OTs out there as well. If you look on the College of Occupational Therapy, you can find them there, but there are within the NHS as well. And you sometimes can self-refer, depends how the service works.
Some children with disabilities teams have OTs attached.
Yeah.
Hidden normally in a closet that they're telling you about, but they are in there.
I think I think the thing is, because they do go everywhere, so you'll find them in loads of different teams. And we're just quite practical based. We're thinking about how you want to carry on and live really, in whatever the difficulty might be, in whatever context. So that was it. Yes. Is that okay? So it's over to Carol.
Carol, I'll take your...
I'm absolutely delighted to be here this afternoon. I brought notes because Tor will tell you, for those of you that are old enough to remember Ronnie Corbett, I do digress a lot and I can go off, so I've got notes to try and keep myself so we can get out before the Tottenham Hotspur supporters and come out angry or delighted, whatever it is. First of all, I'd like to pay tribute to Tor. I mean, one of the things that we did when we were first together was Tor actually filled in a diagram, and when I just saw all the different places where she had pain and her courage in coming along and trying something new when you were rock bottom, so I just want to pay tribute to you, Tor, because you know you can put things in front of people, but they have to be prepared to pick them up and work at them, and you did. And I also wanted to say how interested I was in the discussion this morning, because I'm not an expert in Olliers or Mafucci's, and so I did some research on the net to try and find out a little bit about it. And it said a lot, it said everywhere, that pain isn't a feature of the disease. And I'm thinking, well, I only know TOR, and it's a huge feature of TORs. And so I spoke to our advanced nurse specialist, and she said it is very variable, and so I think that is something that needs to be out there. I mean, I guess that it's probably the people that are having pain that are going to make the effort to come along to afternoons like this. But it is really important that the fact that it is an experience for so many people, that's taken into account really and dealt with. So, well, what else was I to say? Oh yes, so my presentation today is really about chronic pain, and really the origin of the pain is less important than how we deal with it. So, how do I press the one? That's it. Okay. I'm going to take what they call the biopsychosocial model of looking at pain, because above is the definition given by the International Association for the Study of Pain, and it says pain is an unpleasant sensory or emotional experience associated with actual or potential tissue damage, or described in terms of such damage. And this is the new definition that's probably going to be adopted. It hasn't been yet, but this actually covers the other aspects. So pain is a distressing experience associated with actual or potential tissue damage with sensory, emotional, cognitive and social components. And I think some of the things that have come out today, show that how all those aspects go into people's pain experience. And chronic pain is a huge problem in the UK. It affects 43 of UK adults, and the older you get, the more likely you are to have pain. It affects thinking, sleep, sexual function, and it causes anxiety, depression, and poverty, because people do have to give up jobs, and there are extra expenses associated with any kind of chronic long-term health condition. I did read recently that the cost of chronic pain is 4 times the cost of our annual contribution to the EU. So, and you may have heard about the opioid epidemic. It's been in the news a lot, the increasing concern about the amount of painkillers that are being taken. And I think it says 24 million opioids were prescribed. Oh, that doesn't actually show on that, is it? 24 million opioids were prescribed in the UK in 2017. That's 2,700 packs an hour. And whilst opiates are great in the short term, in the long term it can lead to addiction. And I think in 2018 there were 2,000 deaths associated with prescribed opiates. So anything that's going to help you manage pain without having to rely solely on painkillers, which in any case only look at the biological aspect of the disease rather than all the others, is going to be a good thing. So my interest in psychological interventions for pain happened with a patient that I saw some years ago, not long after I qualified as a psychotherapist. And I was asked to see this chap who had spinal surgery to remove a tumour, and they'd done this clever Meccano in his spine, and one of the struts broke and it was pressing on his spinal cord, so he was in acute pain, and his pain team had been to see him, and they'd done everything they could for him with painkillers, and he was still in great pain. So I was asked to go and see him to help him with his anxiety. So I have to say, I was really nervous about going to see him, because I thought, well, I've used relaxation, which is a classic CBT technique for anxiety, but to offer relaxation to somebody who's got a piece of metal in their spinal cord, I was really feeling a bit overwhelmed, really. But I went to see him, and we chatted a bit about where he came from. He came from Ireland. He told me about his life. He told me he was fed up with being in hospital, just wanted to get home. And we had a little chat. So then I asked him whether he'd like to try relaxation, and he said he would. So I said, okay then, I'll have to shut your eyes and blah, blah, blah. He didn't shut his eyes, that's why the eyes are there. He kept his eyes open, fixed on me for the whole of a 20-minute relaxation session. And I was thinking, oh God, you know, I think he's thinking, what does she expect me to take from this hippie shit? I just, so I was feeling really out of my depth. Anyway, I came to an end and I asked him, you know, how that'd been. And he said, he said, well, I don't know where I was away with the fairies, just wait till I tell the wife. So I thought, oh, right, okay. And then he said, and my pain is almost gone. So I sort of tried to act natural, like, oh yeah, I expected that. I said, well, let's just try some, colour imagery as well then. Let's try that. So we did another 10 minutes. And 10 minutes later, he'd got no pain at all. Now, I'd like to say that this was a common experience for me, but it wasn't. I feel like I've been chasing that experience ever since. And, but I do know that psychological interventions for pain are really helpful. I've never met anybody that they haven't been helpful for, even if not as dramatically as with this guy. So that sent me on a quest really to get better. So this is what so the original relaxation was from my cognitive behavioural therapy training. I've learned a lot from my patients, you know, all my patients, and then I thought I'd better try hypnosis. I thought if I'm using imagery, I ought to really have a piece of paper that says I'm qualified to do that. So I went and learned clinical hypnosis, and I learned some interesting stuff, but I can't say it's improved anything particularly, although it has been really useful guided imagery for using it with patients who have had an amputation and who get pain in a limb that's no longer there. And then guided imagery, I don't know if you've come across mirror boxes, where they trick the brain into thinking that the limb is still there, and that the limb is moving, and that seems to relieve the pain. So mindfulness meditation, which has been fantastic for me and for my patients. And also I've learnt a lot from an institution called the Neuro Orthopaedic Institute in Australia. They've got so many fantastic presentations on the net, TED Talks, all kinds of stuff about pain. So they're really worth looking at. So this is the model of pain that we've been operating with for hundreds of years, and it goes back to Descartes. And this is the idea that pain is an input to the brain. So there's damage that happens in tissues, and that pain then shoots up the nerves, and you know, goes up to the brain, and then